I think that I heard one time you said so test, not guess. Can you
Right.
tell us more about that?
Absolutely. Thank you for bringing that up, particularly in Heart Month. Well, it is key that people learn how to sleep well, that people learn how to get some fitness that they can do without harming themselves, that they learn to manage stress without punching walls or finishing bottles of tequila, and certainly that they learn the power of fruits and vegetables, grains and legumes, and make them their predominant or only source of nutrition, which you can do very easily, very inexpensively, and very healthfully. But when you make that transition, you're not always 18 years old, as I had the good luck. I have many patients that tell me proudly, wow, in the last 6 months, I've really adopted this whole food, plant-based, healthy eating. I feel great. I've lost weight. But they carry their genetics. They carry their past 30, 40, 50 years of a different eating style. And heart disease remains the number one risk of stroke and heart attack. What a shame it is to see somebody that's started to adopt a healthier lifestyle and end up in an emergency room or need a procedure or need lots of medications. But that can happen because, 3 months, 6 months, 9 months of changing your lifestyle may not be enough to completely ward off this very big problem of chest pain, shortness of breath, heart attack, strokes in men, erectile dysfunction, which is usually due to blood flow. So I'm not all about what I call high touch. It's not all about get yourself a blender, get yourself an Instant Pot, learn how to make a few simple plant recipes. Yeah, that's very important after we teach even more fundamentally that food is like a medicine and you want to adopt the healthiest choices every day that you can. But I want to make sure that people aren't silently bearing heart disease. Heart disease is a very tricky process. I have a meme I put out there sometimes. If heart disease caused skin problems, everybody would be going to a cardiologist because it'd be obvious and you'd be concerned and vanity. Problem is heart disease is very often without any signs, any clues, any symptoms till boom, the day you call 911 because you feel awful, or even worse, you've had a blackout or an arrest. There's no warning in most people. And yet, that's why the other part of my practice you just mentioned, I call it very high tech. Between blood work in a standard lab, but you have to order some blood work beyond what this typical doctor orders, and a simple observation of how your arteries are doing. If you just think about it for a minute, and it makes no sense. Your doctor will tell you around age 45, let's start getting mammograms every couple of years, or maybe you prefer to get a thermogram. But you're checking, anticipating if you find a disease earlier, you'll be able to treat it more successfully. Let's get colonoscopy, or now there's a stool test called Cologuard. But doc, I don't have any trouble. I don't have any symptoms. Yes, but it's a problem. We don't want to wait till it's advanced. But heart disease, much bigger problem, even though breast cancer, colon cancer, and other conditions are serious. Heart disease is much bigger and much more frequent in 30-year-olds, more commonly 40-year-olds, 50-year-olds, 60-year-olds. We don't do anything. We check a couple blood tests. We check a blood pressure. Maybe your doctor runs an electrocardiogram, the piece of paper, often not. But that's not what we need. So it turns out there are tests just like a mammogram, just like a colonoscopy, but for the heart. Let's identify the problem before it's a problem. And there is a CT scan. Every medium to large hospital in every city in the United States and most of the world offers something called a coronary artery calcium CT scan. Test, not guess. Go lie down in a CT scanner for 10 seconds. Hold your breath. No needle, no injection, no pain, no claustrophobia. My city, it costs $75. You do have to have a doctor that writes you a prescription for a heart artery calcium scan. It's a CT. You pay for it on your own. Some places it's $50. Some places it's $150. Usually not covered by insurance. And you get a report back. Your arteries are like a 20-year-old. Yes. If you're 45 years old and you find out your arteries are like a 20-year-old, your genetics, your lifestyle, even if you've done some things wrong, and wrong is, judgment that smoking's not good for you, which we know it isn't, or your food choices were rather poor. You may have been one of the lucky ones. It doesn't mean keep smoking and keep eating burgers and fries, but when you start this plant-based journey, at least you're starting with a pretty clean bill of health. On the other hand, if that CT comes back and is full of calcium, which is aging. That's why we call it hardening of the arteries. You should see a specialist in preventive medicine to run some labs. And you probably want to adopt this lifestyle even quicker and more completely, staying away from some of the junk plant-based options that are out there now. Simple whole food plant meals that you can make at home without high expense. So test, not guess. We want high fiber. We want high touch, but we need some high tech out there if we're going to stop people from having heart attacks and strokes. The other thing is, in many communities, although I don't like this quite as much, you can pay some dollars to get a screening where they do a quick ultrasound of your neck, your belly, your legs. Something, again, usually not covered by insurance, a little bit more expensive and not as accurate as the CT scan. But do something. Tell your doctor, why did you order a colonoscopy and a mammogram? We're not doing anything to check my heart out. How about one of those calcium CT scans? Many doctors don't order them. Most doctors don't, although it's been around for 30 years, recommended by the American Heart Association and other groups. But certainly something that can change a person's life for the better. My dad had a heart attack. My maternal grandma had a stroke. Oh my God, you just gave me such good news. That's a wonderful thing to share. Unfortunately, it works the other way. Hey, I've been eating and living pretty healthy. How do I have plaque in my arteries? Well, that's where we have to dive deep into lifestyle and genetics and lab tests. But we can figure it out and patch people back together. But eat lots of plants.
Yes, eat lots of plants and be green. Absolutely. That there are a lot of foods that help with lowering cholesterol and so forth. Speaking of cholesterol, Jan on Instagram, she wanted to know what is the recommended level of cholesterol, and I guess we should probably talk about the good and the bad and the triglycerides and so forth. Right. And what if you are on a plant exclusive diet for maybe 5 years and you still can't get to the level? Well, she thinks that someone had said 150 for cholesterol. I'll let you talk more about that.
Yeah, well, there's the standard approach in most doctors' offices is either just using experience, or there are actually what we call calculators. You're 48 years old, your total cholesterol is 220, your HDL, high density lipoprotein, we call it the happy, the good one. That's not true, but that's what we call it, is 72. That's very good. Your LDL, your low density lipoprotein, L for lousy, which isn't entirely true, but it's pretty true, is 154. Your triglycerides are 62, which is low and very good. And you put in the age and you put in some other things and you tell a person, boy, you're really low risk for a future heart attack. Why don't we just work on exercise and diet and maybe eat some meat-free plant meals during the week and cut out some of the butter and the cheese and the lard and the beef. And that's all. And, the calculator might say the opposite. You're very high risk. Here's your prescription for a statin like Lipitor. That's the standard formula. I follow a different school of thought, and I followed that for many decades, which is we do that CT scan first. And if you have no disease, I'll tolerate your cholesterol being a little higher because you don't have any disease. And if you have already some of those spots of aging in your heart arteries, which the CT shows you in 10 seconds for maybe $100, I'm going to want to intensify and get those numbers down. So I deal with each patient at a time, and they're not cookie cutters. They're different. That's called personalized medicine or precision medicine. Now, there are a lot of whole food, plant-based eaters that are frustrated, just as your Instagram follower, that their cholesterol is not 150, but there's oatmeal for breakfast, salads for lunch, and bean soup for dinner. And they're not, chowing down on soda and cookies. We have genetic input, and we can make a lot of cholesterol even with a optimal diet. And it frustrates people. And if there's disease, they may need their plant-based diet plus. First, we have to find out what they're really eating. I mean, are they, rushing off to work with some sort of cinnamon bun that can be vegan, rather than oatmeal, rather than a super green smoothie with chia and flax? Or, what are they eating? And there may be supplements, vitamins, things called red yeast rice, Italian citrus called bergamot. There are things you can do to lower the cholesterol. Sometimes prescriptions are needed in vegans, and that cholesterol 150 is certainly the goal if you have disease. If you've had a heart attack, a stroke, a bypass, a stent, or if you get the CT scan and you find out you've got a bit of a unknown aging of your heart arteries, you want to get your cholesterol down. But there's a famous researcher in Toronto who's plant-based almost all his life. He's in his mid-80s now, David Jenkins, MD. Beautiful man from England, so he has a great accent, even though he's in Toronto. We spent a little time together about a year and a half ago. He did a research study probably 15 years ago. Can we take certain foods that are known to lower the cholesterol, put them together and actually see how much can we lower the cholesterol with diet alone? And those foods include soy-based foods, but not veggie patties. It was edamame, tempeh, tofu. Add more of those in your diet. Add more almonds in your diet. They can bind cholesterol in the gut. Certainly add more oats to the diet. Oatmeal, overnight oats, oat bran, very popular and can lower cholesterol. And more fiber in general with seeds. And he was able to show that sometimes you can lower the cholesterol. It's called the portfolio diet, with just tweaking your plant diet a little bit, as much as a low dose of a prescription drug. So I teach my patients, here's a little handout. If you're already eating well, maybe these little adjustments will get that cholesterol down where you want it or where we need it.
Well, that's good to know, because I happened to, back in 2012 was when I learned about this lifestyle, and I learned, was watching a PBS special with Joel Furman, and right. He talks about G-bombs, yeah. And of course the nuts and seeds are in there, and I still use those in my daily fare. But there's so many plant-based folks out there, especially those who are concerned about their cholesterol, that are just going with this low fat, and if they heard something about almonds, they probably don't even eat them. So it's really good to know that these can be beneficial.
Absolutely. G-bombs, which if anybody doesn't know, G for greens, B for beans. Beans lower cholesterol, greens lower cholesterol. O is for onions, garlic, and garlic lowers cholesterol beautifully, whether you eat it or whether you actually take tablets of aged garlic. M is for mushrooms, great for your immune system, vitamin D. They're full of fiber. They also, and something called beta-glucans. Mushrooms and oats share a chemical structure that can lower cholesterol. And S is for seeds. I also use S for spices because although they may or may not lower cholesterol, you make your food more interesting, but you make it very healthy when you add rosemary and thyme and oregano, oh my God, and spearmint and whatever other spices, with the exception of salt, which isn't officially a spice, a mineral. But yeah, lots of spices. I put red pepper chili flakes on many of my meals. There's some recent data. You may actually live longer with red pepper chili flakes on your food. So spice it up.
Well, that's great, because that's what I do. I'm also SOS free, which is no sugar, oil, or salt. So yes, I incorporate lots of spices, and I hope people will experiment with that, because there's so many different flavors that you can enhance your food with these different spices, and of course add into your health. So now we talked about cholesterol and so forth. So of course the next one would be, we have we have Meredith. She's got 4 questions about blood pressure, so I'll try to kind of go through them quickly. When do you recommend medications? What's considered high, and how often does the reading need to be high? White coat hypertension predict future issues, anxiety, increased blood pressure, if it's still bad, if it's lowered when someone's anxious. So it looks like Meredith is or knows somebody that's trying to lower blood pressure and thinks about these confounding things that may interfere with it.
Yeah, blood pressure gets attention, but it doesn't get enough attention, in my opinion, and I talk about it all the time. I mean, it's obvious when somebody's a smoker. Either you see them smoke or you smell their smoke, and you know that they're raising the risk of cancer and heart disease. They're going to age faster. But blood pressure, again, like heart disease in general, often has no symptoms. You can be walking around every day 160 over 100, where you really should be 120 over 70, ideally, and you will have no clue. But internally, it's aging your brain, it's aging your blood vessels, it's aging your kidney. And worldwide, high blood pressure is the number one cause of death in the world. Over 10 million people dying related to what blood pressure does to our body, from aneurysms to kidney failure to heart attacks, strokes. Serious problem. So you have to be prepared. It's sort of test, not guess. I insist with my patients to get a home blood pressure cuff. And, get a good one, get a digital one, maybe one with Bluetooth. So on your phone app, it'll show all the blood pressures, and you can email them to your doctor or show them in an office visit. It gets away from people, doing all kinds of paper lists of what their blood pressures are. And then remember to do it, and do it right. You're supposed to sit quietly and actually check your blood pressure 3 times in a row. I guess if the first number is perfect, 110 over 68, you're done. But for most people, very often the first number at home is high. Wait 2-3 minutes, calmly relaxing, do it again, and do it a third time, and really pay attention to the third number. That's a recommendation. And do it often. It doesn't matter what time of day. And in fact, I tell people vary it around, morning, evening. Don't check your blood pressure on the treadmill. You're going to trip and fall. And that's a little different. That's what we do during a stress test. And really try and nail it down. It's very tricky to try and get the accurate blood pressure because, as you said, people walk in the office and they're anxious or they're rushed or it's cold outside, except in Florida where you are. A lot of reasons why the blood pressure's up. I usually won't check a patient's blood pressure to the end of the appointment. So they've been sitting and we've been chatting for a while, just trying to give them the advantage for the best results. But home blood pressures are actually the most accurate, or some doctors, in my clinic there's something called a home 24-hour blood pressure cuff. It's a medical device, so you're going to get it from your doctor. There's the cuff on your arm. You're wearing a little box on your belt, but it's not to check your heart rhythm monitor. It's going off every 15 minutes, 24 hours, and you get all kinds of data. It's actually covered by insurance because it's known to be the most accurate. But that's not very practical, and for most people, just check it at home. Ideally, 120 over 70. And I give people time to try and lower the salt, replace it with spices, drop 10 pounds, work on 7 hours sleep, not 4 hours of poor sleep, cut back on caffeine, cut back on alcohol. There are certain foods like ground flaxseed, mentioned garlic or aged garlic capsules, but just garlic in the food, beets, greens, beetroot powder in a smoothie. These are all ways, chia seeds, flax seeds, hemp hearts, to try and lower cholesterol, naturally. Losing weight can be very effective if you can do it in a healthy, sustained manner. Using your treadmill, your bike, your yoga, your Pilates, whatever you like to do. If you're snoring crazy, you probably ought to go get a sleep study or learn how to lose weight and try and see if you can stop snoring. Or strange habit, I have a lot of patients that I recommend they tape their mouth shut at night and they breathe through their nose and they make more nitric oxide and their blood pressure drops and they sleep better, and they love me for the crazy recommendation because it works. Something I do every night, and lowers your blood pressure. So those are all the teas I didn't mention. Hibiscus tea and probably other herbal teas like green teas can help. And after a struggle, if that brings the blood pressure down, fantastic. If it doesn't, then we may have to resort to medication. Of course, if the blood pressure is insane, we may start medication, work on the lifestyle, and then try and withdraw medication. It's not 100% effective to use lifestyle, but in more than half of patients, you can reduce or eliminate medication with all the activities I was talking about.
Well, that's a lot of information that's very helpful, and you're really getting down into the science there, because we have access to some general information, but that's a lot of specifics. And of course, if somebody had a consult with you, you would be able to individualize that and let them know how that could work. So maybe
Sure.
Meredith could contact you. So we have another question from Dave. Oh, he said that he said that he saw your video, the pant paradox, which I know exactly what he's talking about, and so he wanted you to talk about erectile dysfunction and is how that may be a sign and what somebody could do about that.
Yeah, that was a little stand-up comedy video I made a couple.
It was very funny.
There is a book out, of course, many people may know, in 2017 called The Plant Paradox, alleging that one of the most dangerous foods you can eat are beans and peas and lentils, and you should avoid them at any cost. Where if you're in the plant-based community, those are like the foods you eat all the time, and they are legitimately associated with health, not disease. So Dr. Stephen Gundry caused a lot of concern amongst people for absolutely no reason, and he's not a very reliable source in my book. But the pant paradox was a little play on words about how men who eat a healthy plant-based diet are hypersexual because they're fed by such good nutrients and they have better blood flow and more nitric oxide. So the important and the key comments are very important. We already talked about how it can be difficult to diagnose silent heart disease before it's already a tragedy. One of the clues is men starting to develop erectile dysfunction, ED, may have bad circulation to the pelvis, but also bad circulation to the heart. And it's well established in the medical science literature. If you're starting to have erectile dysfunction, have your doctor check your heart, blood pressure, blood sugar, blood cholesterol, and I would say get that $75 heart CT scan. If it comes back perfect, it's probably not vascular problems causing erectile dysfunction. But a lot of men can save themselves an emergency stent, an emergency heart attack, if when that problem starts, they don't just get Viagra, they also get a full heart checkup. So very important to be doing that. Why is that? Because the same things that clog up heart arteries, high saturated fat animal diet, lack of exercise, poor sleep, stress, smoking, high blood pressure, high blood sugar will clog up arteries to the pelvis. So we need clues. It's called, if people haven't heard the term, some people call erectile dysfunction the canary in the coal mine. And it's a cute little historical reference. It's accurate. Miners 100 years ago would take a bird in a cage into the mine. If the bird stopped chirping, the carbon monoxide levels were probably too high for health. The workers can't smell or taste carbon monoxide, but the bird, being a little more fragile than humans, gave them an early warning system to get the heck out of the mine and save their lives. A man who says to his doctor, I am aware that erectile dysfunction can be a clue to early heart disease. Check me out. Where do I get that CT scan? Update my blood work. Check my blood pressure. What can I do with my diet? And diet affects sexual function in men and women. Fruit, which some people fear, eating apples and oranges and papayas and guava and mangoes and grapes. Fruit is actually the food group most associated with good sexual performance in scientific studies, just very rich in vitamins and minerals and nutrients and fiber and something called plant nutrients, phytonutrients. And so don't be afraid to grab an apple or an orange. In fact, do that every day and rotate as many different kinds of fruits as you can. But keep yourself young and sexy and healthy and good circulation. But if you're not in that shape, go get checked out. Very importantly. It's true of women too. It's a little more complex equation. But if your libido is really down, of course, there's many reasons, from psychological to thyroid to menopausal to nutritional imbalances. And don't ask the question, am I aging inside? And that's why I just don't feel as perky as I used to.
I'm glad you mentioned that about women, because some people that are following the plant strong lifestyle, they're familiar with Caldwell Esselstyn's raise the flag thing, but we rarely hear it addressed as far as women go, that can also be a sign that they need to get those things looked at. So that's good to know, and good to know that could be helpful to a lot of people.
Absolutely.
So yeah. Now, we talked a little about almonds, and I incorporate nuts, not as snacks, but I always include them in with my food, nuts and seeds. And so that's going to lead me over into the omega-3s and then the, DHA, EPA. So not everybody's familiar with those things. Maybe you can talk a little bit about that.
Sure. There are nutrients that we make in our body, like vitamin D when the sun is shining, although we can also take them as supplements and to some degree foods like mushrooms. And there are nutrients that we can't make. We have no ability to make vitamin C in our body. We can't make 1 milligram of vitamin C. So we have to eat fruits and vegetables for our vitamin C. Not a lot of people know we can't do that. There's only 4 species on the planet that can't make vitamin C, and humans are one of those 4, and nobody's quite sure why. But for 40 million years, if you don't eat a big salad, a big fruit salad, cherries, berries, you won't get vitamin C, and your teeth will bleed and your skin will look old and your heart arteries will clog up. So another advantage to being plant diet based. But when you talk about omega-3, it's another class of nutrients. It's more confusing, but we can't make them. And it's important for brain health, important for your cholesterol, important for joint health, important for just general body health, getting enough omega-3. Now, there actually is a blood test, which I run on patients. It's available at labs. What's your level of omega-3 in the blood? And you've heard of some of these, EPA and DHA, and there's another one, DPA. We have to eat to get enough. Now, if you're not fully vegan, you probably are aware there's a couple fish, not all fish, but sardine, mackerel, anchovy, herring, and salmon that are particularly rich in omega-3. And if people can find clean, mercury-free sources of those 5 fish and eat them, they'll get omega-3, hopefully enough. I haven't had a piece of fish in decades and decades and decades, so that's not my source. I do eat a lot of chia, flax, hemp. Walnuts are higher in omega-3 than other nuts. Leafy greens are very high. I actually consider chlorella a food, and spirulina, it's an algae. You can buy tablets, and I generally enhance my diet with a few of those. They're rich in omega-3. But sometimes that's not quite enough. And if your doctor is so inclined, you might get a blood test, and there are people that will take vitamins. Of course, the non-vegans are getting fish oil vitamins, whether they're buying them at Sam's Club or Costco or Walgreens or at a doctor's office. And if you're strictly avoiding all animal foods, in the last decade, there's a lot of these capsules that are omega-3, but they're from algae. And they can look and smell like a fish oil capsule, but it's totally animal free and probably a little purer and a little cleaner. It's debatable if everybody needs to take something like that. There are plant-based doctors that discourage it and plant-based doctors that encourage it. I always want to use food, so it's been calculated if you'll make a habit of 2 tablespoons a day, any combination you like, ground flaxseed, chia seeds, hemp hearts, or all of them, you will get enough to supply your body with the omega-3 it needs. And generally that's true, but again, genetics, you may eat exactly the same amount of those seeds that I do, and we have very different blood levels of omega-3. So I like my brain to be nice and flexible and sharp and no brain fog, and getting enough omega-3 from plant-based sources is one of the keys there.
Yeah, that's good to know. I still incorporate the EPA, DHA supplements, and there has been some back and forth with that. So I'm glad that you're on board, because I'm still on board.
Yep.
Now you've written, I think, 5 books now, and one of the books that you wrote talked about Lp(a), and that's, I mean, people are just so concerned about cholesterol and numbers and so forth, but
Right.
that you wrote a whole book on this topic. So of course we don't have that much time to talk about the whole book, but maybe you can tell our audience about that and why that's so important.
Yeah, I'm showing the book because it is a very awkward word. The official name of a kind of cholesterol that's in your blood is called lipoprotein(a). It's often abbreviated, like you correctly said it, Lp(a), the heart's quiet killer. It's a nice book I published last year, and If nothing else, it's full of some absolutely amazing plant-based recipes my friend Beverly Bennett put together, and I get such good feedback about how lovely these are. There we go. But lipoprotein little a is a cholesterol that 25% of people inherit from mom and dad. 25% of people is 90 million Americans. It's 1.5 billion people, and you've probably never heard of it. You get it the day you're born, or you don't get it. 25% get it, 75% don't. It's the most common inherited cholesterol abnormality that humans can experience. The test in the blood, which is very inexpensive, you just ask your doctor, hey, when you're giving me the prescription for my heart calcium CT scan, can you give me a prescription or just check in the office this level of cholesterol? Unfortunately, again, most doctors have never ordered it. In fact, 99% of doctors in America don't order it. Europe, it's a higher number and growing rapidly in Europe because there are therapies coming out that will lower this kind of cholesterol, because standard therapies like Lipitor don't lower lipoprotein little a. Fortunately, whole food plant-based diets lower it some. And you want to do that. Plus, they'll lower your blood pressure, lower your blood sugar, lower your overall cholesterol. But this doesn't show up on your cholesterol. You might say, I just saw my doctor and he said my cholesterol was great. That does not reveal your level of lipoprotein little a. And this cholesterol can clog brain arteries and lead to stroke. Heart arteries lead to heart attack, erectile dysfunction, leg blockage, and interesting blood clots. It's a nasty little beast. It's called the sticky cholesterol. In about 4 or 5 years, there will be drugs, pharmaceuticals specifically for this. They're being researched right now. We're participating in that research at my clinic in Detroit because we do need a drug solution. But nonetheless, it might be a good idea to know your level. If it's normal, please don't start smoking cigarettes and eat hamburger. But be happy that you don't have it and you didn't pass it on to your kids. But if you find you have a high level, you definitely want to stay more focused. Healthy diet, fitness, sleep, stress management, no smoking, and keep a good eye on your heart, including that heart CT scan.
Yes, that's a lot. It's a very good book with a lot of information, and I think it's really important to get that tested. And it's kind of a challenge for some of us that don't have access to plant-based physician or cardiologist who isn't familiar with these tests. And I have a physician, and it's kind of like when you have the good kid and you want to go to parent-teacher conferences just so that you can hear the good stuff. A lot of us plant-based people, we just like to go for the blood test just so that we can get the good report card. But when we ask our physician to test for the LP little a or the omega-3, they and sometimes even vitamin D, it can be quite a challenge.
Yeah.
So
if you're really frustrated by that, which is very common, one, you could walk into the office with a copy of this inexpensive book on online booksellers and give your doctor a gift, educate your doctor. It might change their entire practice. And I mean that sincerely. Or number two, there are places that you can order your own blood work. You're going to pay for them. But, this is a $35, $45 test. Places, they're called wellnessfx.com, lifeextension.com. And I have patients that come in with pretty long lists of labs that they ordered. They did their research, they ordered their labs, and they show them to me, and they spent $250 perhaps. Not everybody can do that, but you can go and do an intern around the medical system if you want to.
Yeah, and it's important to know, because I think we talked about how I'm in Florida, and my husband and myself, we do a lot of things together. And so usually when one of us is outdoors, the others is. And getting that blood work done, I was extremely low in D, where he was just fine. And it was just quite stunning to see the difference, because we really didn't have much of a difference in the time outside. And especially living in Florida, we didn't expect that. And I was taking a daily multivitamin that had D in it, so I did up that D. So I think it's really good to know that these levels, because we can be different. I think maybe because of our skin tone or what have you, that our bodies absorb it differently. Yeah.
Right.
So go ahead.
No, you're absolutely right about that. And that goes with that hashtag you mentioned, test, not guess. When I talk to my colleagues that are in Arizona, California, and Florida, so many of their patients are low in vitamin D, and you say sunshine capital of America, but most of us don't spend all day long outside soaking in the sun, and most of us shouldn't do that. Here in Michigan, we can't do that. We can soak in the snow.
Yes, that's true. I'm having a few questions pop up about COVID-19, and first of all, I just wanted to say that hopefully in a year from now, this will be an old news topic, but obviously it may not be the last of a pandemic that we'll face. So I think this could be good information for anyone, even if that's something that we're not experiencing in the future. If somebody's tuning into this later on. So, do you have a certain protocol that you recommend for, well, trying to avoid it? And then if you are tested with symptoms, what maybe you would recommend doing? Of course, this is a general recommendation because you can't advise somebody if they're not your patient.
Yeah, I'm knowledgeable, but I don't invite COVID patients into my practice for me to treat. There are doctors that do that. It's a cardiology and preventive cardiology practice, but I know the literature. The big missing conversation in most governmental and medical experts over the last year has been lifestyle. Does your risk of getting severe COVID go down if you take your diabetes and improve it dramatically with a whole food plant diet? If you lose 10, 20, 30 pounds in 2020, if you adopted some fitness, if you improved your sleep, lowered your alcohol, stopped smoking, what would have happened to this country if that would have been the message from February, March 2020, from Dr. Fauci to everybody else? You didn't hear that from almost anybody, sadly. And we just throw lifestyle under the bus when it could have been so impactful. I think we learned in maybe August of 2020 that Dr. Fauci takes zinc and vitamin D. Well, although those are still suggested but unproven, it might have been nice to know that half a year earlier. I'm not ripping on him, but he's a pretty prominent face out there. In fact, in March of 2020, a professor I know in Virginia, who is a world-renowned expert in intensive care unit medicine and sick people, he suggested that we consider adding, again, it's not the lifestyle part. You don't hear the lifestyle very often, but make sure you're taking some vitamin D, some vitamin C, some zinc, unusual vitamin most people don't know about called quercetin, but it's in apples, onions, and garlic, so you can eat a lot of those. And he recently updated that recommendation as very inexpensive, safe, possible COVID immune function helpers. So I've been telling all my patients, and I've written many articles that are out there for anybody to read, that these are university professor recommended immune support options. We don't know if it actually works or not, but again, inexpensive, safe, possible. There's a great pressure to disprove vitamins and experiment and prove that prescription drugs work. The pharmaceutical industry, I'm not a conspiracy nut, but just in the headlines the last couple of weeks were some studies on zinc, vitamin C, and vitamin D, and they were just geared to promote the failure of vitamins, just the way they were organized, and they made headlines. The most recent one is the vitamin D study. But yeah, we've missed that message a lot. So lifestyle is the king. It's also good to be under 75, but I can't absolutely give you a formula how to do that if you're over 75. Maybe biologically you can make yourself younger by dropping that weight, lowering your inflammation, blood pressure, blood sugar, upping your nutrition with plant diets of a whole food variety. And that's what I would suggest.
Well, that's good sage advice.
Thank you.
And yes, thanks. Okay, I think we'll take some of the questions that we have that we can post here. This one is from Deborah. Hi, Deborah. Thanks for viewing. Do you recommend? Oh, okay. Do you recommend the COVID vaccine?
I recommend the COVID vaccine, particularly for people who are at risk, over 70, diabetes, heart disease of significance, cancer patients, immune issues. Sure. The only, and I don't have an opinion on which one is better. I think a lot of us are interested to see what happens with the Johnson and Johnson single shot vaccine. There are people that get ill after the vaccine. Some of my own medical staff in my clinic have had that, but it's a significant, but it's a couple day period and they get better. An interesting dispute is what if you've had COVID and you have had antibodies? And although there are recommendations by most to still get the vaccine, there are some very intelligent voices. A professor at Johns Hopkins University, Dr. McCary, that I have high esteem for, who's talked about holding off since there is a supply chain problem. Every time a young person takes the vaccine, that's an older person that's having hassle getting it. Young people are at little risk for serious complications. They're not at no risk, they're at little risk. I had COVID in November for about 1 hour. It was very mild. It was less than the flu, just smell issues. And because of that, I know I have antibodies in my blood. I've checked them. I've not yet gotten the vaccine. I will, because there may be some advantage to having one injection and boosting your antibody level up. But those are ongoing studies. So yes, I think most people should get it. I understand all the suspicion and conspiracy out there. Or many of us looking at the country of Israel, where they have the highest vaccination rates in the world. They're trying to achieve close to 100%. And it does appear that the illness is dropping significantly because of the vaccination. But I'm open to keep seeing what happens there.
Right. Yeah, I guess, the people that I've been listening to have said that, just as we don't have long-term research about the vaccination, we also don't have long-term research about what happens after someone contracts the virus. So either way, you may have to look into the future to see what would happen if you did or did not. So maybe it's just better that you did get the vaccine. So thank you for adding that. Let's see, Becca. Thanks, Becca. What type of tape do you recommend for using to breathe through the nose during sleep?
I'll reach over because this mouth taping is new to me in the last half a year. It's surprising how many experts, how much data, how many people will say, I'll show you something just to make some people laugh. I think I'll find it over behind me in a moment. Yes. My own dentist is a very nationally known expert on mouth and airway. And he recommends his patients, if you can see that picture, we're talking serious taping, like duct tape over your mouth. I found that a little bit too aggressive. I just knew I was a mouth breather at night, dry mouth, glass of water, wasn't snoring. But I found it much more reasonable. You can buy online 3M micropore tape, a roll, and about a 4-inch piece. Men with facial hair will have trouble with this, but kind of a diagonal from top of lip to bottom of lip. It's pretty solidly going to lock your mouth shut. You'll have to breathe through your nose. And I'm going to tell you, I had a lady sitting in my office 2 days ago, and she walked in and said, I'm 20 years younger. And it was only our second visit, and we had done a number of things the first visit. And I really wasn't sure what she was talking about. And she goes, my whole adult life, 4 hours of sleep at night, 4 hours of sleep. Wake up, go to the bathroom, try and fall back asleep, awake for hours. She goes, it's been 3 weeks now, 7 hours every night, 7 hours every night, 7 hours every night. The only thing different was she forced herself to breathe through her nose, which is a much more natural and healthy way to breathe. It's actually much better also if anybody has any gum issues. You do not want to breathe through your mouth at night. It just dries out your gums, and the bacteria love that. So there's many, many virtues. It may lower your blood pressure. It may stop palpitations. A lot of people that think they're getting up at night because they have bladder issues, they're getting up at night because they have dry mouth breathing, and they're awakening and they go to the bathroom, but that's not why they're waking up. So it can be transformative.
Wow. If nothing else, that was just a really great pearl right there. And that's going to be very helpful. Okay, I think we have, Deborah, hi Deborah. Can eating this way, which we do, help with my husband's well, you're going to have to pronounce that. Just
Prostatitis.
okay. He's 81. Any recommendation? He's on 4 milligrams of, you'll say that, and uses only a half a pill per night. So you can say the big words for me, Doc.
It's certainly worth a try because the prostate is very sensitive to diet, as is breast tissue. The two diseases that we think diet most influences in terms of cancer is prostate cancer and breast cancer. Excuse me, and plant-based diets are very powerful, and there is actually science to that. Eating, particularly, they're called polyphenol-rich foods. Eating turmeric, always good to spice your diet up with. Pomegranates, unusual, but very good. Broccoli powder, broccoli raw, broccoli cooked. And finally, I'm blanking on the fourth for a minute that I like to always mention in this list. But these are foods that can improve the health of the prostate, both in terms of cancer and possibly recurrent infection. So yes, there's absolutely no reason he shouldn't try, if nothing else, increasing the amount of foods like that in his diet, and maybe going exclusively plant-based. There's no reason at age 81 you can't do it. Just a little more focus at age 81 on protein, a few more beans, a few more lentils, a few more chickpeas, maybe a smoothie with a plant-based protein powder. At that can be a bad idea, but absolutely.
Okay, well, that's great. I'm glad you talked about protein a little bit. I mean, a lot of the listeners know that protein is not really an issue, but obviously there are certain ages and stages in life that it could be something that needs to be boosted a little bit more due to the phase of life and having the absorption. Right.
The food, it just came to me, that's really good for the prostate is actually green tea. So pomegranate, turmeric, broccoli, green tea, but all the plants are better than butter and dairy and beef.
Well, that's great. So, I mean, we had a lot of questions that were kind of specific to people's individual health needs, and we did talk before about how, not all of us have access to a doctor that can work with us with this lifestyle and try to change our health with lifestyle and instead of just medicating. And we were talking in the green room before we went on air that you actually offer telemedicine. So can you tell us about that?
Yeah, I've been doing this for over 30 years, but I'm a real doctor. There's an office full of people 4 to 5 days a week, although the appointments are half an hour or an hour. So we have time to really get to know each other and know all the details, not just of medications and procedures, but lifestyle and sleep and foods. And that's available. I have licenses in many states, and it's a very enjoyable and actually very effective thing to do by phone, by Zoom, by FaceTime, and other ways that we communicate nowadays. So my clinic is called the Kahn Center for Cardiac Longevity, but the website is kahnlongevity.com, KAHN, longevitycenter.com, COM. And there's an easy way to shoot an email through that. And I can have my great office people reach out to you and we can set something up. We can get it done very much so. Send me labs, send me your tests. We'll talk about your lifestyle and we will figure it out. And I appreciate that. Yeah. drjoelkahn.com is like the overarching website. The clinic itself, you got absolutely right on that little label there. Thank you.
Oh, great. And so now you've authored 5 books, and we talked about a couple of them, and I'm going to put links to all of them in the show notes for everybody. And then where on social media can we find you?
Well, where can't you find me? So
okay.
Instagram, several Facebook pages, and Twitter all the time, and LinkedIn. I show up on YouTube now and then, inconsistently. And, I'm a guest on a lot of other people's topics, so I show up there too. But if you go to drjoelkahn.com, which you flashed up before, there's, connections to all those places. And every day there's new information.
Okay. So is there anything that you might want to add that I know we'll never have enough time to cover everything because of your vast knowledge and experience, but is there anything that you might want to add that I didn't talk about?
It just strikes me, since you do ask that nice question, some people know of two plant-based brothers in Ireland that are known as the Happy Pair. And they're just great. They have a huge following and recipes, and they're fun. And so I just filmed a heart course with them, which is starting on Monday. If you go to their site on social media, the Happy PEAR, the fruit, or you go to my sites like this morning on Instagram, I did post about this course launching. It's very inexpensive. It's very worth it. Fun stuff. I like to, try new stuff and be creative and reach as many people. So we'll certainly reach England and Ireland, Scotland with this course, because that's where their main constituency is. But they're international plant heroes, fun brothers.
Well, that's great. I didn't know about that, so I'm glad that you mentioned it. And I have seen their videos, and they're very awesome. So I'm glad that you're pairing up with them.
Funny.
Okay. I just want to read off some nice things that people said. So I think T said thanks. Somebody else said be strong, be well, and be green. Oh, Jesse said great interview, so knowledgeable. Thank you, Amy and Dr. Kahn.
Jesse.
So, oh, that's very nice. Okay, and I wanted to let everybody know that we have another broadcast coming up real soon, and that is going to be with on Wednesday, February 24th, 6 p.m. Eastern Standard. Mary Riley is going to show us how to clean a Vitamix and other things, a Vitamix container, without toxic chemicals, and she's going to show us much more, because with this lifestyle, we try to stay clean and not just with our bodies, but also with the types of chemicals and cleansers that we use. We try to stay clean with that. So I wanted to thank everybody out there for being our audience, either watching or listening to the podcast. It's your vote. You're here, and when you click and like and subscribe and watch fantastic guests like Dr. Kahn, that's your vote that this is the type of lifestyle that we need to be promoting on the internet. And so I wanted to thank you for that. We had Rebecca in the background. You didn't see her, but she's from PKA Sols, and she's been doing engineering. And we had Jessica from JessTaseVoice.com, and she did the countdown with her lovely voice. And again, thanks to the audience, and thanks to Dr. Kahn. And you guys put your fingers on the keyboard or on your phone and type in "Be strong, be well, and be green" as I sign off with Dr. Kahn, and we say it. And you can say it with us if you type it in. Okay, you ready, Dr. Kahn? Here we go. Till we see you again. Be strong, be well, and be green.
Thank you.
Thanks so much, Dr. Kahn. Thank you.
Have a
Thanks,
wonderful
everybody.
day. Thank you for the opportunity.
You too. Thank you.